Maternal and newborn health care is of particular importance to Uganda. With an estimated total fertility rate of 6.06 children per woman, Uganda has the fourth highest total fertility rate in the world. Despite the various policy calls to action and international networking amongst development agencies, maternal and newborn indicators have barely changed over the past decade. The small district of Kibuku in eastern Uganda has a population of about 200,000 residents. It is largely a farming community. The last 3 years have been phenomenal, especially for women in this district. There is new hope for maternal and newborn health, and that hope is poised to be long-lasting. For the first time ever, maternal and newborn health is a community agenda in this district. And for the first time in a long time, caregivers and facility managers in this district are more responsive to the care needs of pregnant women. These are new winds of change, the new hope. A study codenamed Maternal and Neonatal Implementations for Equitable Systems Manifest is behind these new winds of change. Manifest was implemented by Makerere University School of Public Health in partnership with the districts of Kamuli, Kibuku and Pallisa in eastern Uganda. The aim of the project was to reduce maternal and neonatal death by tackling both demand and supply side constraints. The participatory action research approach, engaged, allows for the participation of different stakeholders at several levels to promote local ownership, use of local resources and structures, and subsequently sustainable project activities and outcomes.
This is the first time we used this approach. I think we have been specifically using health workers, realizing that, I think health was a duty of health workers. And probably that is the reason as to why for a long time we have been struggling with poor maternal child health indicators.
I want really to appreciate this model that Manifest has adopted, where we do joint implementation of activities.
I like two major things about Manifest, at least conceptually. One, the issue of self-help, whereby it was making an effort to empower communities to help themselves, especially on issues on pregnancy, care during labor, and after birth. I think that brings a major difference, that maternal health is not just an issue for the woman, but if it becomes a community issue, I think that is important. The second component that I liked is actually the issue around building capacity of district managers.
And that is the most critical difference that Manifest brings to this field of knowledge. Manifest aims to prepare the community to play their role towards birth preparedness and ensuring safe motherhood, to strengthen health service delivery, and to rekindle leadership at all levels of health service delivery chain. The outcomes of the study were to improve knowledge and awareness of maternal and newborn danger signs among women and their partners, improve newborn care practices at community and facility level, increase maternal and newborn service utilization, increase savings and transport accessibility for maternal health. The supremacy of preparing the community to play their part towards birth preparedness and realizing safe motherhood cannot be overemphasized. The village health teams, otherwise called the VHT strategy, was adopted and implemented.
So these VHTs helped in creating that awareness on what the danger signs are. And when the mothers get to know these danger signs, then they are able to seek for care early and before the complications set in.
VHTs support communities to plan their births better. They offer critical information and encouragement through home visits. Community members were mobilized and sensitized through education talks in the villages by way of community dialogues, radio talk shows, and spot messages. The VHTs mobilized communities to come together and discuss maternal and newborn health issues. The delay in arriving at a health facility for care has been acknowledged as a leading non-clinical factor in maternal and newborn mortality.
One of the causes of the high maternal mortality that we have in this country is as a result of the delay for the mothers to go to the health facilities. So it's important for the women and men out there to know that that you need to get to the health facility early enough so that if the lower health facility cannot handle your situation, then you are referred just in time.
A growing body of evidence suggests that inadequate transport is a significant factor in explaining maternal and newborn deaths. The absence of transport means to transport them to a health facility. The financial and time cost of traveling to health facilities are key statistics to this malady. The strategy for Manifest was to encourage households to save money for birth preparedness that would include increasing access to transport services.
We started these interventions to help to improve access to transport for women while they are pregnant and after they have delivered, and also for their babies in case they get any complications, and also to help them have money when they require it.
I formed this group before even Manifesto. Then Manifesto came and started training us and advised us chairpersons to come and talk to the groups, talk to the mothers to join the group, and then they start some savings.
Kati saa eno we twafuna endowooza ey'enungi nti osobola ofunayo ebitaano waasuulayo, waafunayo 10 waasuulayo. Twasalawo okwetanira ife abakyala naddala ab'omu bugobi bukosa abasinga tuli mu bibiina ebyo. Kale nze neeyanza aba Manifesto abaaleeta endowooza eyo nti abakyala baanakazeere batandikenga okwetegekera kuuko mu biseera byaibwe eby'embuto.
Nakibona nga bw'otereka ssente mu kibiina wazira kikaluba obwetaavu obufuna mu bwangu ate n'abasawo otuuka ye bali nga weeteeseteese bakukola ku mu bwangu.
We also worked with the community development officers to strengthen the existing saving groups, because we found that some of these groups did not have a constitution, they didn't know how to keep their records, they were not registered. So we worked with the community development officers so that they could help strengthen those groups so that when people put their money there, their money is safe.
In the villages where my groups are doing well, the home deliveries have reduced, and they've reduced, and even preparation for birth has improved because of the saving groups. I have very many new groups that want to join Manifest because they've seen the way the other groups that have been involved, how they are doing their things, and they're admiring them.
The groups were encouraged to work with these existing transporters some of whom were already members of these saving groups, yet others were encouraged to join.
Nakavuga kabebida ekunamoiza abalwaire abanyenyere kuba nti kulwala abo tubamanyure n'omuwendo bangi.
But is the border the most ideal means of transport for a pregnant mother?
In case of an emergency, then this mother won't be able to sit on a border. There is a need for proper referral transport.
Efforts are in place to mobilize money to improve referral transport by using motorcycle ambulances. For example, this fundraising dinner is one of those efforts. If a mother has an emergency, they should be able to reach the care that they need in the shortest time possible.
We hope that if we are able to get at least a motorcycle ambulance per sub-county level, then that would still improve on access to transport these mothers to the health facilities.
The health system strengthening component of Manifest has emphasized the following: improving skills of health workers and managers through trainings, support supervision, mentoring, recognition of good performance of health workers through biannual symposia, and provision of essential or basic equipment for maternal and newborn care.
The entire goal of the other components was making sure mothers or expectant women make it to the facility. Now the goal of the facility health system strengthening component was to make sure that the system is ready to receive the mothers who are coming in big numbers.
Provision of essential or basic equipment for maternal and newborn care.
So these things have helped us a lot in that we are able now to resuscitate the babies very well, and we are able to conduct deliveries properly. I remember very well at the time the project started, we even had no BP machine. And right now we have patients who get who have a preeclampsia and eclampsia. I don't know what would have done if these things were not there. The other change which I see is that photograph use has gone up. By the time you came, they had nothing, but now we now have photographs. It was through the initiative of the mentors that we are able to put up photographs and also encourage the midwives to use. That's also good.
A selection of primary healthcare providers, as well as managers, were trained in technical skills to improve on their abilities to provide quality maternal health services.
For example, one of the core courses we learned was principles of health services management. That before you evaluate what you are doing, you have to have a plan in place. And it helped me to draw the plans for the health facility.
Above all, district leaders such as the district health officers undertook a diploma course in monitoring and evaluation. This would help them use data in decision making.
We have been able to realize how much this data is important and how much we can achieve things just by using our data. In terms of collection of data now, we have even established a data center for the health department. We have a fully fledged room with IT equipment purely for data.
In addition, experts undertook mentoring of primary health workers in specific skills such as managing postpartum bleeding and resuscitation of newborns.
Mentorship was a follow-up after we had trained the health workers, giving them updates in maternal and newborn care so that we could have continued contact with them and continue building their knowledge and skills for the provision of health care for the mothers and the babies.
Mentorship has really helped in these health facilities to promote the issue of the teamwork. If you want to improve on something, there must be what? A team. team building is one of the fundamental principles in what? In quality improvement. And now we have these teams.
Similarly, adding experts to the local supervision teams to strengthen the quality of support supervision to lower primary healthcare facilities was undertaken.
By the end of the project, we worked with the support supervisors at the district level, and we told them you're not going to achieve a lot of progress with support supervision unless you tone down on the criticism and you tone up on the appreciation. So it was a collegial kind of supervision, but it was also an action-oriented supervision.
To motivate the primary health workers, a biannual health worker symposium in which they shared their experiences and got rewarded for outstanding performance was introduced and implemented in all the 3 districts.
I appreciate the symposium. We did the symposium under manifest, and they equipped us with the lighting system. Before we were using phones to conduct delivery, and if it's a PG, you need to put the phone in your mouth to give you light. Then candles, which was not all that good, but the lighting system is very perfect for us. Actually, even the mothers themselves are comfortable. Minus a torch, delivery would be hard.
The health worker is in a position of providing compassionate care. That means that their attitude is not something that can be dictated. The fact that they provide compassionate care means that they need to be in a frame of mind that is receptive and compassionate and empathetic. So the system needs to make sure that wherever the health workers are, it doesn't attack them more than it appreciates them.
To me, that was very important, the way really we involved all key stakeholders in taking a decision, in contributing some resources. For example, I remember in one of the districts, the RDC helped to make sure that the radio the radio talk shows are free.
We found that there are a lot of resources within the community. Politicians are a huge resource. They will speak and the community will listen. The politician will say, it is not safe for you to deliver at home, and the mothers will respond by going to a health facility.
I want to thank a manifest because when you came, the mobilization that we did, the stakeholders meetings we have had time without number, the community engagements we have had to have these mothers mobilized in circles, small savings groups, to ensure they're able to save and to plan for their own welfare. I think that was a very sustainable idea.
We think that the use of saving groups and using these saving groups to save for health is a concept that can actually be scaled up. We think that communities, households can be encouraged to save some money for health, to put aside some money particularly for their health.
For me as a district health officer, it is obvious this has worked. The manifest program and people in academia, you can go ahead and do the tests. I don't know, Z test, T test, multiple regression, and removing possible confounders. I really don't care about the tests. But for us, this has worked.
For the 4 years that we've been running on the project, we've seen great changes in the attitude of the health workers, mainly because they get rewarded, not just a reward, someone says, doctor, that made me really happy. So it has changed the attitude, and once our attitudes change, then people work like something is their own.
We have made lots of progress under this manifest project. Maternal and newborn health outcomes definitely improved. Strengthening the health system as a whole was critical to this improvement. We would like to see such a model adopted by many stakeholders, communities, politicians, health workers, managers, VHTs, administrators, saving groups, as well as transporters. All played very important roles in creating a more responsive health system for the communities.
Manifest yields useful insights for health policy planners for maternal and newborn programming. The use of a multi-sectoral approach to address barriers that hinder access to maternal and newborn healthcare is quite resourceful.